Hi, I'm Dr. Gary with Good Medicine Functional Health. This is the fourth in the series on COVID-19. I've been searching the data for the most current and accurate information. Some of the material has been declassified in the past few days, which can have a huge impact on how this virus responds. I'm going to cover what the real data is currently showing, discuss if you need a mask. We're going to talk about the COVID-19 antibodies, about how sun and humidity affect the virus. I will also go into why the U.S. has been hit hard and what you should still be doing. So first, let's look at the facts. As most of you know, the models were wrong, hugely wrong. We hear that the social distancing is what made the difference. The problem is no data is really confirming it. Social distancing, if anything, just extends the timeline. In the past week, a prominent Israeli professor and chairman of the National Council for Research and Development stated his research demonstrates that the spread of COVID-19 peaks after about 40 days and declines to almost zero after 70 days. The results are not affected where it strikes, and no matter what measure governments impose to try to affect it. Some of the countries he reviewed included social distancing for the high-risk groups only, and other countries distancing for everybody. Only retrospective studies will show true numbers, but I'm going with this concept because it follows what is happening. As more test results come in, I am seeing that many more people have had the virus asymptomatically. This makes the denominator, in other words, the number of people that have had the virus, much larger and the death rate much smaller. Initially, the death rate was estimated at 3 to 5%. Some new numbers from Stanford University put the death rate around 0.1 to 0.2%, which is very close to the normal flu mortality. You will start seeing these new numbers being reported in the next few days. This is great news and what I expected, but not good news for the major news outlets that thrive on negativity and fear. When this all started, no one knew the best treatment for patients with advanced cases. Assumptions were made and tried and found that they were wrong. We heard in the news every hour how we need more ventilators, except the frontline doctors found out quickly that when patients were placed on ventilators, their condition became worse and a high percentage died. They found the presentation was similar to that of a high-altitude sickness. It was the oxygen that was needed, not the pressure. So instead of sedating the patient and putting him on a ventilator on their back, they found that if the patients lie on their stomach or recline in a chair, it worked better. This is because it allows for more lung capacity. It is also beneficial to keep the patient non-sedated. In other words, working with the body, not taking it over. So the need for all of those ventilators became a non-issue, except it continued to make news for many of the governors. Also, hydroxychloroquine became a political issue. Many were protesting the treatment, saying that there was no research with COVID-19, that it was unproven. Patients could have numerous side effects, but hydroxychloroquine does work for many patients. Well, like I said in my last video, there was no research for any treatment for COVID-19 because it's a new virus. If people would only use common sense and leave their political leanings at home before speaking, it would help all of us. I never heard once in the media why the hydroxychloroquine works. Research shows that hydroxychloroquine allows greater amounts of zinc to enter the cell, and it is the zinc that blocks the virus from reproducing. So if you see studies indicating the drug does not work, make sure to see if it was used with zinc or alone or with another drug. There's also some interesting research treating some cancers this way. If you are low in zinc, you will have a greater chance for more viral problems. Now you can see why some organizations did not want this information out there. It's not good for drug company profits. Hydroxychloroquine is very inexpensive, and zinc is readily available. Most of the protocols showing lower death rates include zinc, vitamin D, and high doses of intravenous vitamin C in addition to medication. Let's talk about masks. Living in Montana, going to stores reminds me of the old Wild West black and white movies. I estimate that about 50% of the people are wearing a combination of bandanas, surgical masks, and other homemade lower face coverings. I know these people believe they are doing something important. However, the data does not support face masks for most situations, even though the CDC now recommends it. If I was to board an airplane at this time or ride on a subway in a crowded situation, I'd probably wear one, at least temporarily. However, most people are making an effort to give extra space. If you are coughing or sick, they can help protect others, But then again, just as any other illness, you really need to stay home. Also, if you wear a face mask, it needs to be covering both your nose and your mouth. Just fabric will provide very little help. An inexpensive fix, if you want to use cloth mask, is to insert 2 layers of thick paper towel inside the mask. The data shows that it will filter 70 to 90%, whereas the N95 mask filters 95%. Concerning aerosol particles, the research is done in laboratories, which is far different from real life. It is true that the fine aerosol particles can last for extended periods of time, but airflow in the area will dissipate these particles almost immediately. In a house or office, having the furnace fan on all the time could be a possible help. I predict that many office facilities will need to modify their air handling systems to include more air movement. This is not just for COVID-19, but for many other pathogens. The media is talking about antibodies. Let's look at what they are and where they come from and what they do. In simple terms, an antibody is produced from a special kind of white blood cell in your body. It is a complex mechanism that codes the RNA in the nucleus of each cell to be able to recognize an attacking virus. There are some good YouTube videos with animation to watch if you'd like more information. Now, antibodies are made to a specific antigen, in this case, COVID-19. If or when the COVID-19 virus tries to re-enter your body, the white blood cell goes to attack immediately with stored antibody information from the memory cells telling the attacking white blood cells what to do to stop the virus in its tracks. Here's where the problem is. Many experts are talking about the antibody test and using those to determine when a person can go back to work and possibly other freedoms. This is wrong thinking with little information. As of now, no one knows how long the antibodies last. In other words, how long is someone protected? Some research points to only 2 to 3 weeks, and others longer. Only time will tell. Others are hot on a vaccine. Many problems present themselves, including the virus is already mutating. A vaccine for one specific strain has no assurance it will prevent another strain, adding to that the possibility of significant permanent injury or death from the vaccine. The time frame also puts the vaccine at over 12 months from now. By then, the virus will mutate enough that it most likely will not pose a problem. Look at the flu vaccine, for example. It's touted to be such a good idea, except it doesn't work very well. Each year, the vaccine is composed to include usually 3 influenza strains. If they guess correctly, you decrease the risk of that particular strain. However, if they guess wrong, you actually increase your risk of contracting other strains that are not in the vaccine. This year's vaccine increases a person's chance of contracting COVID-19, which has had very little media attention. The Centers for Disease Control website in the past few weeks finally took down the pleading for everybody to get their yearly flu shot. Are these the people we want to be listening to? Every single year, the vaccine is only partially effective due to the drift or mutation of viruses. The CDC also admits many side effects, some minor, some serious. Many vaccines use aluminum compounds, which are neurotoxic to the human system. Anybody that has memory issues, dementias, Alzheimer's, or other neurodegenerative conditions, or a family history would do well to consider the potential side effects of these non-essential vaccines. Let's talk about sunlight. In the past few days, a declassified report from the Department of Homeland Security was released. The report shows the virus decays with relative humidity over 40% and with high temperatures. This is good news for some of the Florida beaches that were recently opened. The paper states outdoor solar light rapidly inactivates the virus. Sunlight reduces the infectious virus to undetectable levels after just 3 minutes of exposure to the solar equivalent of midday sun on a sunny day in the middle latitudes of the U.S. So if you are in Florida, Texas, Tennessee, or other states, you will be greatly benefited with some sunbathing. 15 minutes of sun exposure without sunscreen can also provide great vitamin D production. I know so many of you are concerned about the sun and skin cancer. Again, it's way overplayed. Some studies show that regular sun exposure is associated with lower melanoma risk. Sun is very good in moderation. Too much, like anything, can give rise to significant health issues. One of the best things we can do both physically and emotionally is go on a walk or a hike. So, why has the U.S. been hit hard compared to some of the other countries? It's not what you are hearing on the news. I think most people in this country believe we are healthier than most other countries. Unfortunately, the data does not support it. There are at least 35 countries with better health and 47 with longer life expectancy than the US. For a country that has the best medical technology, who has the best emergency procedures and some of the most amazing surgeries ever developed, to be that far down the list as a result of a failed healthcare system. It would fall even further down the list if we went to a nationalized healthcare system. You see, the problem isn't what is being done, but how and why it's being done. 80% of the healthcare dollars spent are for chronic diseases, such as diabetes, heart disease, obesity, and others. I recently read an article from the Journal of the American Medical Association titled, "Why is the U.S. life expectancy lower than other countries?" The United States spends almost twice as much per person on healthcare than any other country, but our life expectancy is less than other developed countries. The life expectancy started falling in 2014. In this country, we had the most robust cancer screening of any nation. Heart attack survival rates keep getting better, and more people are on cholesterol medication and all the other drugs advertised so heavily on TV. So why do we fall so far behind? The authors point to the problem. We are in a treating mode and not a prevention mode. They got it right. Those of us in the natural medicine arena have been saying it for years, and now the research is supporting it. We hear all the time about prevention, but very little is done to implement it. We need to remember preventative tests are not prevention. Most people with chronic health issues in the U.S. are treated with drugs to mask the symptoms and not addressing the root problem of lifestyle, what we eat, how we exercise, how to control our stress, and do we have genetic factors that can be modified. The beautiful thing is, with functional medicine, we can help you address those things and tailor them specifically for you. Let's look at the 6 realities about changing your health. Number 1, anyone can improve their health. Number 2, health is a journey. Some changes happen quickly and other underlying problems can take years to resolve. Number 3, great health is comprised of nutritional, physical, emotional, and genetic factors. Number 4, once you start on a path to better health, there will be situations that work at derailing that process. It's up to each of us to get back on the path. Number 5, if you choose to improve your health, you need to do it for yourself. Changing habits for loved ones or others never leads to long-term change. And number 6, people who are committed to changing their health can enjoy the rewards of a full life. I think more and more conventional doctors are realizing their efforts are not making the changes they would like to see in their patients, but don't know what to do. Medication can be beneficial in certain situations and for a limited time. We will discuss these issues on another videocast. My current recommendations for ongoing COVID-19: don't let up now. You want to continue to keep your immune system functioning at a high level at all times. First of all, drink lots of fluid, bone broth, vegetable broth, and lots of water, at least 50% of your body weight in ounces of water per day. Onions, leeks, and garlic, great. Continue to cut your sugar intake to the least possible. Also avoid artificial sweeteners and processed foods. Avoid those genetically modified foods as well. Eat larger portions of washed vegetables and lower glycemic fruits, organic and non-GMO if possible. Use coconut oil as one of your cooking oils. Continue with vitamin C. If you've not had your vitamin D level checked, now is a great time to do it. There are at-home test kits. The level should be between 50 and 80. Very, very important. If you have been taking zinc more than 60 days, I would reduce it for the next 30 days. Higher levels above 60 milligrams of zinc should not be taken more than 60 days unless your body has a higher requirement that has been shown on testing. Melatonin at 3 milligram dosage. This also helps most people sleep better. However, if it keeps you awake, take it in the morning. Probiotics, between 70 to 90% of our immune function resides in the digestive tract. If you do not have a healthy balance of good bacteria, your immune system will be compromised. Taking high-quality multi-strain probiotics can significantly improve the function of the bacterial balance and make your body more resistant to outside organisms. For accuracy, a DNA stool test should be done to look at the variation and amounts of beneficial and pathogenic bacteria. If you're interested, contact our office or another functional medicine doctor. I will also mention many of the probiotics being sold are of poor quality and will not even make it to the targeted digestive tract due to the acidic environment which they must pass through. Increasing the amounts of fiber will also help your body produce more good bacteria. Any supplement you might decide to purchase, go for either pharmaceutical or medical grade. Most of the other grades have little, if any, quality control. Daily exercise, very important. Try to get 6 to 8 hours of sleep and do everything you can to control your stress, especially since most people are home more. This is just a very generalized list and is not meant as a prescription because we are all genetically different. And each of our bodies require a different level of supplementation. There is no one size fits all. Functional testing is essential to get accurate data regarding what you need. I will try to post a new segment on how our genetics impacts our daily health in the next week. Over the past few years, this integration of genomics and our ability to alter our genetic function has caught my attention and I've spent considerable time focusing on it. It is the future of healthcare. Bottom line, we need to and will get back to normal at some point, hopefully sooner than later. Each of us has a choice. We can either work at becoming healthier and have our body as prepared as possible for the next epidemic, pandemic, or we continue in our current condition and worry about what's next. I hope you make the better choice and take charge of your health. If this seems overwhelming or if you just need a little help, call our office and let me walk you through the functional medicine model of health, as I have with many thousands of other people. Thanks for tuning in today. I hope the information will help you navigate our current COVID-19 situation. I do keep a list of topics to cover. However, if you have one that you would like me to cover, email us at info@goodmedicinefh.com.